When discussing COVID-19, first I think it's very important that we understand exactly what we're talking about. COVID-19 stands for Coronavirus Disease 2019. Coronavirus is simply the family of viruses that COVID-19 comes from. Coronaviruses have caused things as simple as the common cold, which we all get yearly, to something as significantly and dangerous as SARS or MERS, which both have high fatality rates. COVID-19 is actually somewhere in between. The fatality rate is usually between 3 and 5%. However, it's highly contagious. And because it's so highly contagious, and if people get it, there's a chance they could die from it. We've had to start something called social distancing, or some of us call physical distancing. The social distancing has caused anxiety for multiple reasons. First of all, because of the social distancing, we've had to really change the economy. A good part of our economy has been shut down, and this has led to people losing their jobs, or fear of losing their jobs, or even just a decrease in their income, all of which has changed the way we live. Secondly, there's that fear that you could get COVID-19, and because there is a chance you could die from it, that alone leads to more anxiety with people. Lastly, the social distancing has had a dramatic effect on people, and it can be very anxiety-provoking. First of all, we're social beings, and so we're used to doing things with other people. We no longer can go out to eat like we did. We can't go to movies or go to shows, or even just go and hang out with our friends. All of that has led to a real change in how we lived our lives and changed our routine, which leads to increased anxiety. Plus, the fact that how we do our jobs has changed. In the case of healthcare, some of us now work from home when we used to work in a facility. And then if we are working in a facility, we're now having to dress differently. We're all having to dress in scrubs. Many of us didn't used to do that. And on top of that, we're having to wear masks all the time, even when we're not around patients, and wear gloves or frequently wash our hands constantly. And all of these things are changing the routine and can cause us to worry more or be more depressed. So what are some things we can do to help either if we're seeing a change in our routine, having to stay home more, or if we're having to go to work, but just our work environment's changed? Well, I think the first thing we always talk about when we're dealing with any kind of anxiety or depression is being able to stay on a constant schedule. It is critical that if you're staying at home, you're still getting up at the same time, going to bed at the same time. If you're working, you want to work the same hours. Kind of try to keep that 8 to 5 time. You don't want to have your work bleed into the evening. The other thing we also want to focus on is not only keeping ourselves on a schedule and making sure we're getting up at the same time, but also our kids as well, because it's very easy right now, especially when many are not in school, for them to wake up at different times and not be doing school at the appropriate time. So it's important that they keep a schedule as well. As we know that if kids' schedules get disruptive, it becomes then their behaviors become disruptive, and it can cause a lot of friction. The other thing that we really encourage people to do is, even as you are finding that you may have less to do, is still make sure that you're doing things that you enjoy. If you like to read a book, make sure you're reading a book. Listen to music, do that. Even things like just going outside. Those are things that are all critical. We also talk about making sure that you maintain and you're eating eating a good diet, because it's very easy to fall into a pattern of either eating too much or eating not enough, or changing how you eat. And those types of disruptions can make us feel worse. We might gain weight, or if we're just not eating the right foods, we might not just feel as well. Also making sure that we're doing exercise. It's very easy, the gyms are closed, it's very easy to fall in a pattern of not exercising, but we know that exercise keeps our body working optimally, and also keeps our emotionally keeps us regulated, as we know that you can release endorphins when you're exercising, which makes us feel better. So it's critical that we exercise. Also making sure that we think about how much substances we're taking, whether it's drugs, or avoiding drugs altogether, and really drinking. If we are drinking, make sure we're doing that in real moderation, because it's very easy, again, get bored or to get anxious, and maybe start drinking more than we typically do. The last thing we always talk about is really watching how much news or how much information you're taking in about COVID-19. I always say keep it down to 10 or 15 minutes a day at the most. It's very easy to turn on the news and get a constant feed of COVID-19. And a lot of times the news can be more dramatic, and a lot of times really driving some anxiety that we might not otherwise do. So really limit the amount of news you're taking in.